with Will on 531 VI.
Malolele, this is Pacific Mornings with William Terite. It's good to be in your company this Tuesday. Now, Pacific elders in Aotearoa are receiving far less community support than Pākehā. And a new $1.2 million study is asking why. University of Auckland psychiatrist Dr Etuini Ma'u joins us to explain what this research could perhaps mean for Pacific families and why on earth this is even happening in the first place. Malolele, thank you very much for your time.
Well, Malolele, well, thank you for having me.
I mean, look, what first drew perhaps your attention to this gap in community support?
Look, I mean, I've been a psychiatrist for 15 years now, and in my clinical work looking after older people, what we're seeing time and time again is that particularly Pacific and Māori families are struggling at home. They have a higher health burden, they've got more health issues, they tend to be younger when they develop these health issues, and yet there's this massive gap between the need that they have for support and the support that they're actually receiving from the government. And I think fundamentally the system is failing at multiple points along the way.
And look, I want to dig into that a wee bit deeper. In terms of what patterns, based off, say, your clinical work in Waikato, for example, I suppose what patterns have you noticed that made you think, hang on, we're missing people here?
Yeah, look, I mean, like I said earlier, we know that our Pacific communities, our Pacific elderly,
Sure.
We tend to live in more disadvantaged areas. That means that our access to health services, our ability to afford health services is not as robust as the general population. But we know that even if Pacific people are getting assessments, it's not translating into access to the funded supports that the Ministry of Health provides. So the motivation for this research is really saying, how can we identify the people that we're missing? How can we actually quantify it, put a number on the number of people that aren't accessing services so that we can go back to the ministry and say, here's who we're missing. These are the people and the populations that we need to be supporting.
Could you give us an explainer, and perhaps I may even be saying this wrong, so do apologies in advance, but I suppose on the is it RAI? Is that what it's called?
Yes.
Okay,
Yes.
So what on earth is that?
So the Inter-RAI was brought in by the Ministry of Health about 15 years ago now. And effectively what it is, it's a standardized assessment that everyone must have in order to access the supports provided by the government.
Right.
And we know that our Pacific people aren't even receiving that assessment to the same degree as other populations in the first place. And then even those that do receive the assessment down the line, they are not receiving the supports that should come with that assessment for a multitude of reasons. And I think so there's barriers right from the point of getting the assessment through to those who have the assessment even being assessed as eligible for the supports that the government will pay for. And then there's a big question mark out the other end about the type of supports that are available and whether our people even see them as appropriate for the needs of their elderly.
Sure. Could you elaborate on some of those barriers?
Our Pacific communities and the way they interact with the health service isn't as frequent or as robust as other people. So even getting in the door to see a doctor, we're already dropping the ball at that point. We know that our Pacific families want to care for their elderly at home, and that's great. But there's an assumption from the health service then that because Pacific families are stereotyped as wanting to look after their own families at home, sometimes the assessment isn't even offered. And there are other points where even the families that have an assessment, what tends to happen is that the family will minimize the problems or minimize the difficulties that their loved one is experiencing and kind of gloss over how much work they're actually doing for their mum, their dad, their loved one, so that the assessor takes it at face value and says, well, actually, it sounds like you're managing fine. It doesn't sound like you need any support.
And could you elaborate, I mean, on this study in terms of the scope, how many people you'll be talking to, you know, in order to perhaps quantify the problem?
Yeah, sure. So basically what we've got the funding for is to go out to the community. We're working with a couple of Pacific providers in Auckland and here in Waikato. And we're going to go to these providers and we're going to give this assessment to about 400 Pacific people over the age of 60 who've never had an assessment before, because that will tell us how many of those 400 are actually eligible for an assessment, but for whatever reason have never had one.
Yes.
And that's really going to quantify that unmet need that we're seeing clinically day to day.
Right. Okay. I see. I see. All right. And so, it's no secret in our Pacific cultures, maybe it is, but it's kind of frowned upon to put our elders into a rest home. And I think you've described that caregiving burden as massive. What are some of the stories or situations you've encountered that perhaps picture this or illustrate it?
Yeah, look, there's some great work being done by people like David Moeahi at the Pacific Dementia Māngalo Service in Auckland. And they are supporting people through the dementia journey as one specific illness to focus on. And what he's describing and what he's seeing in his service is elderly Tongan patients coming in who have a fairly advanced dementia, who have never accessed supports. We know that people with dementia, for example, require a lot of caregiving support. If you're not getting that from the government or any assistance from the government, then the entire cost and burden of that is falling on their families. We know that caregivers will have to leave the workforce to care for their families. We know the emotional toll that it takes. We know that they don't look after their physical health as well. So this is not just about Pacific elderly. This is about the entire Pacific community and saying, if we can tap into supports and resources that are available from the system, then hopefully that can go some way towards reducing the burden on not just the person, needing care and support, but also their families.
Do you see differences between Pacific communities, say in Auckland, Waikato and Christchurch, and how families manage elder care?
I mean, we don't have that specific data. I think anecdotally what we can say is that outside of the big centres of, say, Auckland and Wellington, where there is a concentration of Pacific people, the smaller centres don't have the same number of Pacific elderly, which means that it's much more difficult to develop sustainable services, supports and programs that they'll actually want to participate in.
Right. Okay. Okay. And I just want to also pick up on another point as well. What do you hope will come out of, say, these Talanoa sessions with Pacific elders and their caregivers at the end of the day?
Excited about the Talanoa aspect of this. That's going to be led by Associate Professor Sionevaka from the University of Waikato. And really, this is going to be about talking to Pacific elders and their families at every step of that journey through the system to find out from them what the barriers are. What are the barriers they experience and face to actually, going to see their primary care doctor to get a diagnosis, to get referred for an assessment. If the assessment happens, what kind of experience do they have with that assessment process, with the types of questions that are asked, with the assumptions that are potentially made? And then out the other end, if they are utilizing services, what are their experiences of those services? We know that many of the services in New Zealand at the moment are designed for the Palangi majority because they've made up the overwhelming number of people over 65 in this country. But we also know that our Pacific population over 60 is going to double in the next 15 years. So we really need to be prepared.
Sure. Yeah, I see. I totally see. And, if this research shows a clear unmet need, which, presumptuously I'm going to assume so, I mean, what would you like to see change at, say, government or health provider level?
Look, I think that's a great question. I think the first thing we need to do is actually put a number on how many people are missing out. And that's the main aim of this project. The second aim is what Associate Professor Sionevaka is leading, which is to say, yes, here's the people that are missing. Here is why we're missing them. And here are the pinch points that we can then address and go back to the Ministry of Health and say, these are the points in the system where access to an assessment is failing, where the assessment itself is failing, or where what's on offer out the other end is not seen as suitable. Because I think, Will, for too long, policymakers and the ministry at large, we tend to hide behind concepts like filial piety. We hide behind, it's kind of generalizations that Pacific people want to look after their loved one at home. They don't want to go into care. They don't want to use support. And I think that in this day and age, there are supports available from the Ministry of Health that potentially can be tailored a lot better to our needs.
Yes. Yeah, couldn't agree more. Fascinating stuff. Well, all the best with this study, a study perhaps that we've needed for quite some time, so thank you very much for getting on top of it, and I look forward to what comes of the findings, and appreciate your time on the show. You have a lovely rest of your day. Mai taki mata.
Malabito.
That is